Hi, I'm Dr. Lacey Stell, and I'm the Breast Program Director here at UW Health Swedish American. We have a lot of new things going on with our breast program here that we're really excited about this fall. Despite all of the things going on with COVID, we still are moving forward and doing a lot of big stuff with our breast program. One of the really cool things that we just decided to offer here at our main campus on State Street is to do walk-in Wednesdays. This is just from 2:30 to 4:30, but women can come right in and get their screening mammogram done without even having to have an appointment. There may be a little bit of a wait, but we definitely want women getting their mammograms this October and supporting Breast Cancer Awareness Month. So we are offering that new service, and we're very excited about it. Another really neat thing that we're offering now is if women have MyChart on their phone, on their smartphone, there's an app for it, and they can get right in there or just go onto the internet and do it there too. And they can go into their MyChart account and they can schedule their own screening mammogram for whatever time is convenient for them. They can see what spots are open, and they can just check the schedule and see what works for them and schedule it themselves. They can also cancel it, reschedule it, whatever they need to do. So that makes sure that we're getting everybody a mammogram when they need to get it done. A really important service that we're offering now is high-risk breast screening. And what we mean by that is we have a physician assistant who specializes in breast health, who's able to assess a woman's risk for breast cancer and figure out really what's the odds she's gonna develop breast cancer in her lifetime. So 1 in 8 women do get breast cancer, which is 12% of the public population. And so that's a pretty big number, but we actually consider someone to be at an increased risk when it's over 20% lifetime risk. And so we have these risk calculators that we can use to evaluate that and give a woman a good clinical breast exam, figure out if she needs to get mammograms earlier than age 40. Maybe she might benefit from doing whole breast ultrasound or breast MRI in addition to the mammogram. So that's one piece that we are really wanting to promote in our community, so that way we can identify women before they've developed breast cancer. Another big piece about this is the genetic counseling. So learning if a woman might have a gene that causes breast cancer. And that's something that really takes an assessment. The provider has to really dig through the patient's family history and figure out who had breast cancer, on which side of the family, at what age, were there any men with breast cancer, things like that. And that allows us to really individualize a woman's risk, and then we can kind of treat them accordingly and possibly do genetic testing. And we do have a full-time genetic counselor on our team now too. For those of you who haven't had a mammogram recently, we definitely want you to know that here at our main campus at UW Health Swedish American off of State Street, we offer the very top, highest level quality mammogram service available. And what that's called is 3D tomosynthesis. And I know you might have heard something about this. We talk about it a lot, but the mammogram machines have changed. They are far more comfortable for a woman to get their mammogram. I do have patients every once in a while tell me that 10 years ago it was miserable getting a mammogram. It was so painful, so terrible. And then they go and get one now on our newer machines. It's shorter, it's much more comfortable, and they just say that things are night and day from what it used to be 10 years ago. So I think that's important to remember that, even if you had, hopefully not, but if you had a terrible experience in the past, give it a chance, come and get your mammogram, see how it goes. I promise you, here at our State Street campus, we're gonna take very good care of you. We have a new plastic surgeon. Her name is Dr. Catherine Sham. She comes to us from Madison, and she is going to be offering us a lot of additional advanced breast reconstruction techniques that we weren't able to offer previously with our UW Health Swedish American breast team.
I'm Dr. Catherine Sham. I'm really excited to be joining the breast care team here at UW Health Swedish American. One of the new techniques that I'm going to be bringing is something called autologous reconstruction, and that's where we actually use the tissue from a patient's abdomen, in some ways giving them almost a tummy tuck. It's a little bit different, but using that tissue to then move it to the chest and reconstruct a breast. Your abdomen becomes flatter after the surgery, which a lot of patients are really excited about. A lot of times we can actually combine it with the surgery that you get for the mastectomy with Dr. Stell, and actually maybe only have one surgery for all of your cancer treatment, including removal of the cancer as well as reconstruction of the breast. So that's a really nice advantage that we can offer for some patients. When Dr. Stell has to do a mastectomy that includes removing a patient's nipple for just to treat their cancer the best, sometimes that can really make patients feel a little bit more impacted by their cancer surgery. And so another one of the techniques that I'm able to offer is actually doing a surgery for nipple reconstruction. And that is often kind of like the cherry on top for at the end of a patient's reconstruction, making them feel like they've kind of completed this journey and have a good outcome from their breast reconstruction.